Fascia and the release of it, what we know so far, and what does my baldness have anything to do with it? The intention of this presentation isn't to bash the healthcare providers who practice various fascial release techniques. The intention of this presentation is also not to question the efficacy of the treatments provided by fascial practitioners. The intention of this presentation is to review the evidence contradicting the beliefs that fascia is the cause of pain and that it can be fixed by highly skilled manual therapies or by various tools. Here's a newsflash. I'm bald, and I shall be discussing the relevance of my baldness. Male pattern baldness, or MPB, is the progressive hair loss from the front to the top of the scalp and affects 80% of men by the age of 80 years. There are many studies and observational evidence supporting the clinical existence of baldness, such as male pattern baldness, current treatments, and future prospects. Male pattern baldness at age 45 years were positively associated with colorectal neoplasia. Oh my goodness. Our studies suggest a weak association between male pattern baldness and a few coronary heart disease risk factors. Wow, I'm in trouble. A 2018 meta-analysis concludes that male pattern baldness has been associated with an increased risk of prostate cancer. I'm doomed as a bald person. And also, male pattern baldness may be associated with increased risk of skin cancer. And finally, this meta-analysis compared over 11,000 men with male pattern baldness to 11,000 controls. The data provide molecular evidence that rather than being an isolated trait, MPB shares a substantial biological basis with numerous other human phenotypes and may deserve evaluation as an early prognostic marker, for example, for prostate cancer, sudden cardiac arrest, and neurodegenerative disorders. So what can we conclude from these studies? Male pattern baldness causes cancer and heart disease. Is that true or false? It's false. Preventing male pattern baldness may help prevent cancer and heart disease. And that is false also based on the studies I presented. Finally, getting a hair transplant may cure cancer and heart disease. Obviously, that is false based on the studies I've provided. The only thing we can conclude from all these studies is that male pattern baldness is simply associated with certain types of cancers and heart disease, but the link is small. Association doesn't mean cause and doesn't mean that if baldness is treated, it would prevent or cure any other disease other than baldness. From baldness to fascial restrictions. Fascia is quite trendy, with little evidence that fascia actually matters in manual therapy. Fascia enthusiasts are also often quite vague in explaining how exactly fascial work can help people with persistent pain. Fascia enthusiasts are, however, very clear and confident when discussing papers about how complex and widespread fascia is. But let's not forget that muscles, bones, nerves, skin, and hair are all also widespread in the body. Just because it's everywhere is not a good enough reason to isolate fascia as the cause of pain. Fascial release practitioners attempt to prove that the practice is based on sound anatomical science. Yet if you ask for one evidence-based and clinically relevant paper demonstrating the validity of fascial evaluation and treatments, you get, well, nothing. Sure, fascia research is growing and are presented at several fascia conferences around the world, but to date, none of that research has been shown to be clearly relevant to therapy. Many overzealous fascia practitioners take these well-intended studies and assume conclusions that are well beyond what the studies and papers actually present. There are many sound medical papers on male pattern baldness, but none to date have had any clinical influence on preventing the condition, reversing the condition, or reducing the risk of cancer and heart disease associated with my baldness. Again, the studies looking at the anatomical and the biological structure of fascia are quite interesting, but to date, quite irrelevant to direct patient care and helping those with persistent pain. Knowing the detailed biology of hair and hair loss has done me little good. Although my hair loss is associated with cancer and heart disease, knowing about hair follicles has been of no value to me. Some fascial practitioners claim that fascial tightness can be the primary cause of certain painful conditions, similar to that of compartment syndrome. But the challenge is, structural and mechanical properties are unlikely to explain chronic compartment syndrome. To prevent chronic exertional compartment syndrome, it's necessary to address aspects other than the muscle fascia. This is a quote from a comprehensive study on compartment syndrome. The fascial distortion model, or FDM. In 1991, an American osteopath physician, Stephen Tippeldos, formulated the fascial distortion model and proposed that most musculoskeletal complaints are caused by deformations of fascia. Since then, and after dozens of studies, no one has to date scientifically demonstrated that fascial distortions exist. Fascial distortions can be palpated by hands of an expert clinician, and no one to date has demonstrated that fascial distortions can be altered by manual therapy techniques. But we do have lots of studies on the histological and biological properties of fascia, again, none of which have been shown to clinically matter in direct patient care. A literature review found no clinical trials or basic research studies to support the empirical foundations of the fascial distortion model contentions. A review paper appropriately concludes that the first step is to conduct randomized controlled trials to verify whether fascial distortion model has any specific treatment effects in the short and long term. Once clinically relevant benefits have been demonstrated, studies can then begin speculating about the plausible mechanisms underlying fascial distortion model treatment. For now, the reverse is happening. How is fascial distortion treated? Well, you can melt it using the melt method. You can blast it using the fascial blaster, which is a massage tool. You can gua sha it using rocks. You can distract it using various cupping techniques. You can scrape it using instrument-assisted soft tissue mobilization, such as the Graston technique or fascial abrasion technique. You can release it using gentle manual therapies, such as John Barnes' myofascial release, or aggressively using various massage techniques. So how should one release fascia? Aggressive force? Moderate force? Gentle touch? Fascial practitioners claim to be able to change fascia using semi-mystical healing powers, far better than us regular mortal healthcare practitioners can provide. Without scientific evidence supporting the validity of the fascial distortion model, similar to a spiritual healer or psychic practitioners resort to saying, "Trust me, I can feel it." There's no evidence or any reason to suspect that the state of fascia can be changed even by forceful manual therapy, let alone delicate manipulations. There is no way to think it can be changed gently without faith. Here's a quote by Paul Ingram from his website, painscience.com. Is fascial therapy faith disguised as science? Excuse me, but do you believe in the power of fascia? Again, this image was borrowed from painscience.com. Even if it was scientifically demonstrated that skillful and gentle manual therapies could have an effect on the fascia, one would still have to prove that the changes in the fascia are associated with clinical improvements in pain and function when compared to other forms of manual therapies. Allegations that clinical experience is sufficient to validate therapeutic results have been abundantly refuted in the literature. In his viral YouTube video, Hadley confidently explains that stiff feeling you have is the solidifying of the fuzz. That theory turns out to be highly presumptuous, with no evidence to support it. Also, one other little problem with the fuzz theory. The fuzz is connective tissue that is stiffened during rigor mortis and doesn't happen unless you die. The paper, Three-Dimensional Mathematical Model for Deformation of Human Fascia in Manual Therapy by Chowdhury, is considered a gold standard paper by many fascial therapists. The paper clearly concludes that the forces required for actual plastic deformation of fascia exceeds what can be applied by hands. Therefore, the claim some make that they can actually detect a fascial release lacks any credible scientific backing. Dr. Robert Schleip, who is a well-respected fascia researcher, describes fascia as so tough that plastic change in response to manual loading is improbable. As a bodywork clinician myself, I've learned that there's hardly a more dangerous attitude among therapists than the hero healer manipulator who is damn sure about his diagnosis and supposed treatment effects. Various studies are often quoted by fascial enthusiasts as evidence that tight fascia may be a cause of low back or neck pain and should therefore be addressed. For instance, this study demonstrated that the thoracolumbar fascia is thicker and stiffer in people with chronic low back pain. However, the researchers in no way concluded that thickened and stiffened thoracolumbar fascia was the cause of back pain, or that it could be solved with manual fascial release techniques. The paper simply finds that tight fascia is sometimes associated with, not the cause of low back pain. Remember my baldness? Male pattern baldness is simply associated with certain types of cancers and heart disease. But it's not the cause. Association doesn't mean cause and does not mean that if baldness is treated, it would prevent or cure any other disease other than baldness. The studies showing fascial stiffness may simply be demonstrating that reduced soft tissue mobility is a consequence of pain rather than the cause. Does it really come to anyone's surprise that certain tissues stiffen up when we don't move, especially when we are in pain for a while? So what can we conclude from these studies on male pattern baldness and fascial distortion model? Male pattern baldness causes cancer and heart disease. False. Fascial deformation causes persistent pain, which is false also based on the studies to date. Preventing male pattern baldness may help prevent cancer and heart disease. False. Preventing fascial deformities may help prevent persistent pain. False also, based on the current studies. Getting a hair transplant or a wig may cure cancer and heart disease. False. Changing fascial restrictions may resolve persistent pain. False. We don't currently have studies to support that statement. This presentation aimed to question the common proposed theory behind fascial release. I'm hoping that with ongoing research, a decade from now, I will either become even more skeptical of fascial release or change my position and say that I was wrong, which I'm always happy to do. In the meantime, a more plausible explanation for various manual therapies may be neural modulation, meaning that placing the hands on a patient's skin in a non-threatening way can result in dermoneuromodulation, which may reduce the perception of pain and stiffness. Diane Jacobs. To learn more about this topic, I recommend the book by Diane Jacobs titled Dermoneuromodulation and the website by Paul Ingram, a pain scientist, and the website is painscience.com. And this information was received from his article, Does Fascia Matter? A detailed critical analysis of the clinical relevance of fascial science and fascial properties. I feel confident challenging critics to cite even one example of fascial research with clear, direct relevance to what happens in treatment. If such a thing exists, I will be happy to publicly discuss it and acknowledge my oversight. I could be wrong about fascia. I even hope that I am. Paul Ingram. Half of what we know is wrong. The purpose of science is to determine which half. We're trying to prove ourselves wrong as quickly as possible because only in that way we can find progress. The greatest enemy of knowledge is not ignorance. It is the illusion of knowledge. Stephen Hawking. So the next time someone knocks on your door and asks, "Excuse me, but do you believe in the power of fascia?" reply with, "Although the evidence is growing that biological and histological changes in fascia potentially do occur, resulting in fascial distortion, such as contractures or adhesions post-trauma. However, to date there is nothing to support that 1. They're clinically relevant to the pain experience. 2. They can be clinically identified with any form of manual therapy. And 3. They are treatable with any form of manual therapy. In the meantime, I'm not at all concerned about my bald head or any fascial deformations that I may have. There's no need for me to fret over either one." For more educational videos and presentations, please visit the Aptai Video Library. Thank you.